everyone, so let's move towards our today's topic, which is
Renal tubular reabsorption part 3. We have discussed in the part 1 the overview of this tubular reabsorption. In the second part we have discussed the reabsorption in proximal tubule, loop of Henle, ascending part, descending part, distal tubule, the first half of the distal tubule. Now in this lecture we have to know, we will discuss the second half of the distal tubule and the cortical collecting tubule. We were at the topic that the second half of the distal tubule and the cortical collecting tubule are similar in function. How? They both consist of two cells. They both consist of three types of cell. Number 1, intercalcated type A cell. Number 2, intercalcated type B cell. And number 3, principal cell. You should know these things are very much important. You should know the name of these cells. Okay. Now the function of the principal cell is to reabsorb sodium and water. Okay. Because the principal cell consists of sodium potassium pump, so sodium and sodium will be secrete, and sodium will be reabsorbed, water will be reabsorbed, and potassium will be excrete out or will enter into the tubule so that it can be excreted out of the body. If I talk about the type A intercalcated cells, so what happened? They will secrete hydrogen ion when there is acidosis condition. In acidosis, we all know that in acidosis there is a high amount of hydrogen in our body. When there is a high hydrogen ions in our body, the type A intercalcated cells will take the hydrogen from our body and they will secrete into the renal tubules so that it will excrete out of the body because there is an excess amount of hydrogen. But if I talk about the type B intercalcated cells, they will help in the condition of alkalosis. When there is low amount of hydrogen ion in our body and high amount of bicarbonate ions, so what they do basically, type B cells will take the bicarbonate ions and they will secrete into the tubule so that it can excrete out of the body through urine. Okay. In alkalosis, type B cells will work, and in acidosis, type A intercalcated cells will work. The last topic and the easiest thing, reabsorption in medullary collecting tubules. The 10% of the filtration, the 10% of the reabsorption will take place in this site, and this is the final this is the final site of the reabsorption. This is the final site of the reabsorption step of the urine formation. Okay, what happen in this tubule? Basically, antidiuretic hormone, we all know that will be released, and if it is releasing, that means if there is a high amount of antidiuretic hormone, that means high amount of water reabsorption will take place. And if there is a low amount of antidiuretic hormone, that means water reabsorption will be low. अगर हम पानी ज़्यादा पीते हैं, ठीक है, और हमारी बॉडी में पानी की ज़्यादा ज़रूरत नहीं है, मतलब हमने ज़्यादा पानी पी लिया, हमारी बॉडी को जो रिक्वायर्ड था उतना हो गया, तो फिर क्या होगा कि वाटर रीएब्जॉर्ब नहीं होगा, वाटर सीक्रीट आउट हो जाएगा हमारी बॉडी से. दैट विल कॉज ऑब्वियसली डाइल्यूट और कंसनट्रेशन यूरिन की भी बात होगी, बट वो इन द नेक्स्ट लेक्चर. But in this lecture you have to know that medullary collecting tubule will also help in acid-base regulation because it secretes hydrogen ion as well, and they are helping in water reabsorption. So this was the whole topic regarding the reabsorption in tubules, renal tubular reabsorption. Till then, what you need to do is work hard, study hard, and good luck. Take care. Bye bye, and remember me in your prayers. Thank you.